Welcome, and thank you for viewing my comprehensive MSED LOC presentation. I will present my problem of practice and how my coursework informs my current role with a hospice company in South Central Texas. Hello, my name is Elena Wood, and today I will demonstrate how the Learning Foundation strand of my graduate coursework applies directly to my work as a hospice community liaison. Through the lens of teaching for understanding and instructional design, I will highlight how adult learning principles, engagement strategies, and structured instructional approaches guide my professional decisions and performance. To improve patient outcomes and reduce hospital length of stay, healthcare teams must collaborate across hospice, home health, palliative care, and discharge planning by identifying patients earlier, offering timely family-centered education, and honoring patient choice through seamless interdisciplinary transitions of care. My service area includes interdisciplinary clinical and service marketing teams, short and long-term nursing facilities, doctors, patients, and families within the hospice care landscape of practice. I apply adult learning principles by respecting prior knowledge, encouraging self-direction, and creating emotionally supportive environments. Drawing on Knoll's concept of andragogy, I facilitate learning that is problem-centered and immediately relevant. For example, when orienting new staff, I present real-world scenarios instead of abstract policies to promote practical understanding. As an adult educator in healthcare, I regularly navigate emotional, cultural, and knowledge-based boundaries with patients, families, and referral sources. I apply Malcolm Knoll's andrological model to establish autonomy and relevance in these interactions. Adults value practical, self-directed, problem-centered learning. In my role at this San Antonio-based company, I support clinicians, social workers, patients, and their families. I help ensure timely and compassionate referrals. I envision leading an initiative to improve how providers understand and communicate about hospice care. I would use engagement, imagination, and alignment to disseminate findings from my proposed study. As Bradford et al. Emphasize learning environments that encourage metacognition and real-world relevance, I engage colleagues in storytelling from case studies until they have experiential stories to draw from that spark their imagination by proposing appropriate end-of-life care solutions and ensure alignment of connecting findings to our mission and patient outcomes. Additionally, I use Vygotsky's zone of proximal development to challenge professional boundaries by scaffolding support when staff, patients, or families face emotional or procedural uncertainty. I also help professionals step beyond their comfort zones by facilitating reflective dialogue about death, empathy, and family dynamics, topics often avoided. This encourages transformative learning. Using scaffolding techniques such as modeling, real-world examples, and visual aids provides learners with a supportive learning environment where questions and feedback are welcome. This, in turn, motivates the learner, minimizes frustration, speeds efficient learning, and personalizes the learning experience. Asking questions like, what do you know about hospice? When is a patient appropriate for hospice? Think about patient X. What could have been improved if they'd have been on services for 2 months versus 2 weeks? And why do you think that is? This allows learners to imagine scenarios beyond modeling and develop alternative, more personalized learning. My problem of practice is the late referral of patients to hospice care. Studies show that more than 50% of hospice patients receive care for less than 30 days, far below the 6-month eligibility window. According to Hoger et al., National Hospice and Palliative Care Organization, 30% of those die within the first 7 days. This drastically limits the time patients and families have to benefit from the full scope of services. The widespread misunderstanding that hospice care equals death and dying is a contributor to this statistic. This misconception creates fear, delays referrals, and undermines the support we can provide. Addressing this through instruction can shift perceptions and improve earlier access to care and much-needed resources. To address this issue, I would analyze the current referral process, investigating stakeholders such as referral partners, intake nurses, medical directors, by methods of observation, feedback sessions, and documentation review. I will use pre- and post-assessments, interviews, and referral data to evaluate the impact. This mixed methods approach ensures that I capture both measurable change and user feedback to redefine the program as needed. Utilizing Gagne, I would address the problem of misconceptions about the role of hospice by analyzing where these misunderstandings occur, whether during physician consultations, initial family meetings, or through media influence. I'd analyze what language is used, what questions are asked, and what knowledge gaps continue to persist. To further address this, I propose developing an engaging asynchronous instructional program. It will address myths, misunderstandings, and the referral process. This format not only conveys knowledge, but fosters reflection and ownership among busy healthcare professionals. Utilizing basic principles of Bloom's taxonomy in concert with Mager, I would write objectives that specify behavior, conditions, and criteria. These objectives clarify expectations and ensure instruction is targeted. To address the problem of practice, I would craft objectives such as, given a family consultation, the liaison will explain hospice as supportive care that includes pain management, emotional support, and quality of life measures using clear and compassionate language. These objectives ensure targeted, measurable communication skills. To address instructional design strategies, I would apply Gagne's 9 events of instruction, such as gaining attention with real case of communication breakdown, guiding with examples, and offering feedback through role play. I would engage participants with real patient stories, providing learning guidance through case-based examples, and reinforce understanding with simulated family conversations. Wiggins and McTeague's backward design would ensure alignment between objectives, strategies, and assessments, reduce fear, and increase timely hospice engagement. This structured approach ensures employees not only learn new behaviors, but also sustain them, supporting long-term organizational change. This program has helped me develop a theory-to-practice mindset. I have the knowledge and experience to apply academic tools to real-world impact. My goal is to position our hospice as a thought leader in educating providers about end-of-life care. In conclusion, the Learning Foundation strand has equipped me with theory-driven tools I use daily. Whether I am applying adult learning principles to support families or designing instruction to improve provider communication, I've moved beyond theory into meaningful context-specific application to change perceptions about hospice. By merging adult learning with instructional design, I ensure the training is respectful and effective. Adults need relevance, autonomy, and reflection opportunities. Using narrative performance-based learning and feedback enables understanding and transformation. I apply adult learning principles to educate and empower my colleagues and community partners. Through structured instructional design, I address misconceptions and delays in hospice referrals. This work reflects what I have gained through the MSED LOC program and demonstrates my ability to lead change in a complex healthcare setting. Ultimately, my goal is to ensure that more families experience hospice as a source of comfort and empowerment, never as an afterthought. Thank you for your time and every opportunity, past, present, and future, that this program has provided me. In the most horrible upturned time in my life, Baylor University was there, and the relationships forged in the EdLoc program carried me. I dedicate my work and my degree to my late husband, Charles Richard Wood, Ricky, and to my children, Alexandra, Austin, and Aiden, who have lovingly and patiently supported me and encouraged me through this journey. I would like to also say a special thank you to my person, Chris Papachek, who has encouraged me through each iteration of this process with unwavering support and encouragement. And finally, to my Sick'em Six family. Thank you for supporting me and being by my side every step of the way and never leaving me behind.